Yo, 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 what's going on, good people? It's your homie HerbMan, and you back upside the head with another, you guessed it, hot banger boogie. Hey, look, go tell somebody that your homie HerbMan is on. And if this is your first time tuning in to the HerbMan show, go ahead and hit that logo right at the bottom of your screen right there and hit that notification bell so that you never ever miss a daily, weekly, monthly episode of what we bring to the table here on the HerbMan show. All right. So let's get right into it. What are we talking about today? I want to keep you guys in the loop of what's going on with the all well-known virus that is going on, but I also want to educate you on the whole scenario behind viruses and bacteria and fungus and all that type of stuff. Now, all three of those are very, very much different. Okay, so an antifungal and an antibacterial and an antiviral would pretty much be three different types of things because those are three different things. And bacteria is a twofold situation where there are bad bacteria out there, but it's also good bacteria. And so we want to be careful with antibacterials that we don't disseminate the good bacteria that is very much needed for us and for our gut health. We want to make sure that that's still around, right? That we're still able to receive some of that good bacteria. So we want to be careful with antibacterials. All right, antifungals. Of course, there are a lot of fungus that is very harmful to our health, but there are also very good funguses, and we know a few of them, like the mushroom family, right? Where we, especially now when we're trying to improve our immune system and all of those types of things, mushrooms like reishi and shiitake, maitake, and cordyceps and lion's manes, and all of these different mushrooms are going to be very, very good to help stimulate our immune system, help support our B cells and T cells and strengthen them so that they could be ready and willing for the fight. So again, that's a situation where you have a twofold situation where you have some good fungus and you have bad fungus. Okay, so you have to be careful with antifungals that they don't just disseminate the good fungus that you definitely need, that's going to come and support you in your time of need. All right, and so now the same with virus, except for viruses is not a twofold. Most viruses are all bad. Okay, and what a virus is coming to do is it's coming to hijack your cell, hijack the host, and it wants to replicate itself. Okay, so it comes to hijack you. It'll come to infiltrate your cells, and then it wants to proliferate itself. It wants to grow and replicate itself. Okay, it wants to kill you, and then it wants to grow itself. And in growing itself, it creates an army that will be a big nemesis to your immune system. Okay, and so that's what it wants to do. It wants to get in, it wants to deteriorate your good cells, and it wants to proliferate its own self so that it can fight against you and defeat your own army within you. Okay, so with that being said, we have to do the things that are necessary to make the necessary precautions for this stuff not to happen inside of our bodies. All right, so some of the things that we need to understand is the upper and the lower respiratory tract, and what are those things constitute as, and how do we catch colds and flus and influenza and all these different stuff, and why does it normally affect the respiratory system? So that's what we're going to go through today. All right, and so one of the big differences between the upper and respiratory tract are the organs or the tissues that they normally tend to function. All right, so the upper respiratory tract is normally conducive of your nose, your larynx, and your pharynx. Okay, and the lower respiratory tract is normally conducive of the trachea, the alveolar, all of your bronchi and all of that type of stuff. And it's normally the lung tissue and the functionality of that tissue. So it gets more in depth. It's more about the lungs itself. Okay, so what we got to do is, when they tell you not to put your hand on your face, or when they tell you to make sure you're eating a diet that does not have a high mucus forming content of foods, then this is why, because this is your first line of defense is your nose and your throat. Okay, your nose and your throat. So if you're putting your hands to your face, then things can get through your nose. Okay, if you're eating a diet of high mucus forming foods, then now you're putting stuff in your throat. Okay. And when you're doing these particular things, this has a degree of an effect on your immune system, okay? And so just like with stress and with a lot of other stuff, it will cause your immune system to operate on a lower level. And this is the entryway in for most colds and flus and pneumonias and bronchitis, sinusitis, and all these different things that we get, which we call the respiratory diseases. This is how they come in, mainly through the nose and through the mouth. Okay, and then they get in there and then they get into our lungs and they begin to affect our lungs. Okay, and what happens is we have an immune response in our lungs, and now all of your immune system go and try to figure out what's going on with the lungs. And when you have all of that attention in your lungs, if your lungs is not operating appropriately, if they're not dispelling waste and removing waste appropriately, which is the carbon dioxide, right? You breathe in oxygen, you breathe out carbon dioxide. If you have this immune response because you have inflammation in your lungs, it can cause a lot of congestion in the lungs, okay? And if it's not operating appropriately, you got a lot of built up traffic in there, which is, again, congestion, or in other words, constipation in the lungs, okay? And when you have this, that makes it hard for you to breathe, okay? And then you have where you're trying to, cough up a lot of phlegm, or you're trying to, you have a runny nose where you have a lot of mucus coming out of your nose and all this types of stuff. And so that's why we really want to understand the differences between the two and understand what we could really utilize when it comes to herbs. Herbs have been very, very helpful, very useful in this particular category of colds and flus and respiratory issues. Okay, so herbs has a very, very good background when it comes to dealing with respiratory diseases and issues. And so, these types of viruses that come out, we have things in nature that we can utilize to deal with them that people have been using for years. And so one of the things we got to understand is the upper respiratory tract will require anticatarrhals, okay? Anticatarrhals, all right? And this is going to be herbs that are going to be helpful with removing excess mucus, all right, out of the lung area, okay? And you're going to need that for your upper respiratory tract. All right, so that's going to be removing the phlegm and removing the excess mucus, okay, out of there. But we want to be very careful. We don't want to run ourselves bone dry. We need a certain amount, a certain level of mucus. So you want to be very careful with anticatarrhals and mucolytic herbs, okay? Mucolytic herbs. Mucolytic means an herb that will also thin out the mucous membrane, okay? Or it will remove the excess mucus as well, and make it very easy for the body to remove the mucus, the excess mucus itself, okay? So that's what a mucolytic is, and an anticatarrhal does some of the same thing. Now, an expectorant. An expectorant is what you're going to really, really need when you're dealing with lower respiratory tract infections. That's when it's gotten down into the lung tissue, okay? That's when it's dealing with your air sacs and your alveolar and your bronchial tubes and all of those types of things. That's when it's gotten down into the trachea and all of that. That's when you really want an expectorant, all right? And you want to, it's the same thing, you want to try to cough up that phlegm. You want to try to get it up as much as possible. But you want to be careful with expectorants because you have two different degrees of them. You have stimulating expectorants and you have relaxing expectorants. And sometimes when you have a stimulating expectorant, it can really agitate or irritate the lungs so that it can cause for that, for you to cough it up. All right. And a lot of people may not necessarily like that. So you may want more of a relaxing expectorant, something that kind of goes in. It doesn't irritate, but it loosens up the mucus. All right. And it allows the body to naturally go ahead and remove it and cough it up at a particular a natural time that it's supposed to do it. All right. So you may need a stimulating expectorant or a relaxing expectorant. So you need to definitely know and understand what you need to utilize when and where. Okay. So it's not all about throwing all of the long herbs at a respiratory issue just because you have a virus or cold or flu. You got to know what, why, and when. Okay. So some of the expectorants that you can use for a lower respiratory tract infection or virus is echinacea. Okay, it's gonna always be very good anytime you're dealing with any immune system issue, and also too lobelia. Now I would suggest that you do your research in lobelia. That is a very good herb for it to be an expectorant and have a great expectorant action to it. I would suggest you probably utilize lobelia over echinacea, but echinacea as a whole is not only going to be useful for it being an expectorant, but echinacea is good for immune stimulation and just overall good for the whole body, especially when you're dealing with the cold and flu season. All right. And when you really want to add some support to your immune system, echinacea is going to always be one of the great herbs for that. All right. And another one is always going to be golden seal. Okay. For your anti-catarrhals. All right. We're talking about herbs like hyssop. All right. And we're talking about herbs like coat's foot. Now for kids, coat's foot is going to be very good, but you don't want to use coat foot, especially the root very early on is very strong. You definitely don't want to use it more than 30 days at a time. You really want to go back and look at what is done. It has been helpful, and give your body a break if you're using coat's foot. All right. But that is very good for kids, coat's foot. All right. Hyssop again is a very good anti-catarrhal. Now, also what we're going to need is immunostimulants. All right. We're going to need something to strengthen our cell walls again. But why? Because the virus wants to get in there and then it wants to wreak havoc and starts to proliferate itself. So we want to make sure that our walls are strong enough to fight against the virus as well before it even enters into the cell. All right. And we also want to make sure our bodies are strong. So we want immune stimulants, things like echinacea. Again, we're talking about the mushroom family when we're talking about reishi mushrooms and cordyceps, and we're talking about shiitake mushrooms. All right. Lion's mane, and all these particular things are going to be very good for immune stimulants. All right. And you're also going to need pulmonary tonics. All right. Or what we call pulmonaries. And these are going to be very good. And I listed 2 different types of pulmonary tonics. So you're going to have your upper respiratory pulmonary tonic, and you're going to have your lower respiratory pulmonary tonic. All right. And so for your lower respiratory tract pulmonary tonic, you want to look at things like elecampane mixed with a little coat's foot, mixed with a little mullein. All right. Those 3 together gives you a great pulmonary tonic. Now, what is a tonic? We know that a tonic is going to tone and nourish the tissues and the organs. All right. So even when we're talking about the nose, the larynx, and the pharynx, you want a tonic that can tonify and strengthen those organs, because those are organs. All right. And even with the lower respiratory tract, you want something that will tonify and strengthen the tissues, all right, the air sacs and the bronchial tubes and all of the bronchi and all of the alveola. You want that to be toned, and you want it to be strong enough to do its functionalities. And so here, elecampane, coat's foot, and mullein is going to be very good for the lower respiratory tract, and it being able to tonify those tissues and those functionalities that the lower tract does. All right. And so for the upper respiratory tract, we have eyebright, golden seal, hyssop, elder, goldenrod, and nettle. And those herbs together in equal parts is going to be your pulmonary tonic for your upper respiratory tract system. Okay. And those are going to tonify and strengthen the nose, the larynx, the pharynx, and make sure that you're at optimal strength to ward off and protect you from invaders like viruses. Okay. You're also going to need diphoretics, and diphoretics are going to be that thing you're going to need to break that fever. All right, so you're really going to want something for that, and you're going to want something for the elimination of toxins through the skin. And bone set is one of those herbs that really do it. And I know a lot of people think bone set is for the bones, but it's actually one of the best herbs you can use for fever, to break a fever. All right, things like feverfew and bone set, those are going to be the things you really need. Now people think because feverfew says fever that it's best used for fever, when actually feverfew can be used for fever, but it's actually best used for a headache. So you got to really know the herbs, and you got to really understand what they do. Now you may need a nervine to relax your nerves, okay? To not only relax your nerves and calm you down, but also to relax the nerves in the bronchial tubes, all right? To relax the pulmonary nerves going through your lungs. You may need something like lobelia, wild lettuce, or hyssop, okay? And that will provide that nerviness, that nervine effect to your body, to allow your vessels to relax, so that a lot of these herbs can do its job, all right? You're gonna need an antimicrobial, all right? And you could use stuff like garlic, eucalyptus, thyme, wild indigo, myrrh, or licorice root, okay, for your antimicrobial, because we want to still make sure that our body is able to fight off any foreign microbes, okay? You may need an astringent. Now, when you're dealing with astringents and mucolytic and sometimes even the antimicrobial, this is going to be when you're really dealing with the upper respiratory tract. It's going to be very good for that. An astringent, something like sage or eyebright is going to be very good, because an astringent, what it does is it kind of contracts the blood vessels, or it stops bleeding, or and so you may need that astringent effect a lot of times when you're dealing with excess mucus, all right, and you want to kind of dry things up, you want to kind of constrict things, close things up, then you may need something that has an astringent effect, and sage and eyebright are going to be very good for that. And again, a mucolytic herb, all right, something that dries up mucus or that thins out the mucous membrane, is going to be elecampane. All right, so I gave you all those herbs. You can kind of do your own research and figure out how you can make your own blends, how you can make your own tonics, how you can make your own tinctures and decoctions, so that you can make your home a more safer place. You know, that's something that you really want to try to do. And I put over here to the side just some of these vitamins and minerals that you definitely want to supplement with all of these herbs and teas, especially if you're trying to take care of yourself. And one big one is going to be vitamin C. But you can't have vitamin C without vitamin D, and you really need magnesium in order to have vitamin D. So vitamin C, vitamin D, and magnesium are going to be very good. But because you don't want to really mess with any of your B complexes, you're going to need B12 or something like bromelain or something like that to really make sure that your gut flora stays intact, and also too that your gut flora helps you fight against some of the viruses that are going on. Because again, you remember, you got about 80% of your biome is in your gut. Your microbiome, meaning your bacteria life, is really in the gut, in your gut lining. And that bacteria can help you. You can utilize some of the good gut bacteria to help you fight off and ward off things that are coming into your system. But you got to know what it needs in order to work for you and work optimally in you to ward off some of these things. You're going to need zinc. You're going to need iron. Just to name a few. So, you know, you want to make sure that you get foods and herbs that are good in iron. You know, when we're talking about iron, you already know sarsaparilla, okay? Burdock root are going to be very good with iron, okay? You know, when you're talking about your B12s and stuff that's going to be good for your gut, that's going to take you back to all of your gut herbs and foods, okay? Things are going to be good for the gut are going to be slippery elm and licorice root and marshmallow root, and it's going to be foods like bananas and a lot of the foods that got mucilage in it, like okra and things of that nature, that can provide its own mucus to you so that you can protect your lining of your gut and all those types of things. Also too, that will promote a stronger microbiome in your gut. It's going to be foods like fermented foods like sauerkraut, yogurt, and things of that nature. Kefir is going to be very good at keeping the microbiome strong, but also too giving you more good microbiome or more good gut flora so that you can help yourself out fighting off these viruses and these diseases. Magnesium is also going to be good for your muscles and to help you relax. So that the nervine mixed with the magnesium is really good for muscle, all right, relaxation and for nerve relaxation, okay? So that you can allow the things to work properly and flow properly through you. Vitamin D, we all know, is going to be very good at a whole lot of things, but one of them is going to be bone strength, okay? Bone strength is very, very good. Immune support. Vitamin D is going to be very awesome for immune support as well. And there's only a few places you can get vitamin D. So sunlight is going to be very, very good for you. Outside of sunlight, you can get it from a few vegetables, but it's not a whole lot. So I would just advise you to add some sunlight to your diet, okay? You need to get you at least an hour or two of sunlight every day. And then, of course, you got vitamin C, and we all know that that's going to be very good for immune support. But you really need all of them together. And here are some of the herbs that hopefully can get you through these troubled and perilous times. And I hope you guys are never, ever allowing this stuff to really, overly stress you out or, put fear into your heart, into your mind, into your spirit, which really then accumulates in your attitude and your aptitude about the subject matter. And it can really cause you to really be stressed out without even really knowing it. And that could also lower your immune system too. So make sure that you're watching what you eat, that you do not eat a diet full of high mucus forming foods. Make sure you're cleaning your hands daily as you should have already been doing. Make sure that you're eating a variety of different foods that will give you a variety of different vitamins and minerals that you definitely need. And make sure you do your homework on all of God's given medicines, okay, which are foods and herbs that he gave to us. And all you got to do is do your research to know exactly what your body needs and which food that you need and which herbs that you need. And I promise you that there will be nothing out here that will be able to bring you down. Okay, so do your work, do your homework. Hopefully everything goes good for you. If you got any questions, any concerns, please feel free to hit us up at our email at leafofvitalessentials@gmail.com. You can also follow us on Facebook and Instagram at Leaf of Vital Essentials INC. We're on Twitter at Love HerbMan. And you can also go to our website at www.leafofvitalessentials.com, where we have pretty much all of these herbs. You can go ahead and buy them and they'll show up at a doorstep near you. All right. Until next time, I love you guys, and there's absolutely nothing you can do about it. Go tell somebody to go tell somebody. Peace. Yes, sir.